Well, we're here today with Dr. Williams, a dentist in Tampa, Florida. There's sunny Florida. Lots of crocodiles walking around in the middle of the street of Tampa. Is that true, Dr. Williams?
Just in my backyard.
just in your backyard. And since you're a dentist, are you brushing those teeth, those crocodiles' teeth? Are you making sure that you keep them? They come for you when they have a toothache, right?
I stay at arm's length distance, Helmut.
Okay. Well, all right, Dr. Williams. Tell us a little bit about your practice and the philosophy. You see, even though a dentist is a dentist, to most of us people who are not dentists, there's some truth to it, since most of you dentists do obviously the basic major work and all that. But at the same token, different dentists do have a different philosophy. So please tell us your philosophy in your practice. What can a patient expect in your practice? And maybe even tell us, Dr. Williams, what made you becoming a dentist?
We'll start at that point first. What made me become a dentist? Around the 7th or 8th grade, I had a very good friend of mine who was 3 years my senior that I looked up to, and his name was David. And I asked David, what did he want to do when he became an adult? He said, a dentist. So me, looking at David as my role model, said, well, I'm going to become a dentist too. So I pursued that from the 7th grade until this very day. David went on to become a counselor at the University of Notre Dame, and I pursued dentistry and have been well rewarded with it.
Okay.
So, in terms of my practice, I have a diverse practice in terms of procedures and patients population as well. I've been in the Tampa area for over 17 years, practiced in Tampa strictly, coming out of the University of Florida where I did my dental training and did my specialty training at the University of Missouri in Kansas City. And from there, I came back to Tampa and opened up my practice. I deal with IV sedation, dental implants for replacement of one or missing teeth. We deal with the periodontal procedures in terms of treating gum disease, bone disease, missing teeth, infection, abscesses. We do extractions as well within our practice. Limited occlusal analysis we do in the practice as well. And we also see children from the age of 5 years and up.
Great.
In terms of what got me my practice philosophy is we want to use our God-given talents to help the patients who come through the threshold of our office. So we want to make the patients feel like comfortable and at ease when they walk through the office, because dentists are the last professions that patients want to see. So we can help them to relax through music that we put on their ears, through laughing gas that we can give them, through oral sedation or IV sedation. We can get those patients through any dental procedure if they truly want to get it done.
That's wonderful, because sedation dentistry really is wonderful for people who, perhaps have lots of fear of a dentist, which is really not justified anymore these days. Dentistry doesn't hurt anymore the way it used to. So it's all, lots of, mystery from the back. But anyway, if a person is afraid, he is afraid. And B, it's for people who want to get lots of work done, and they work in the morning at 10, work out at 3 o'clock in the afternoon, and for all purpose, they're done. And lots of people like that. Lots of people love that, because as you said, you guys have a really hard job as such, because on one hand, we need you. I mean, we need many people, but when a person has a toothache, it's that dentist is like, really, a lifesaver. And yet we sit down in the chair and say, gee, I hate being here. And, it's kind of like...
And I hear that often.
I'm sure you do, a car salesman or, most people don't hear it as often, even a lawyer. We don't want to go to a lawyer, but I'm almost sure the dentist, we hear it even more often, like, okay, I'm here because I have no freaking other choice. I really don't like it, and I hate nothing against you, right, doctor. I just hate you. So anyway, wonderful.
Right.
Having the heart in it is definitely a good thing, and stuff. So it looks like people can get just about anything done in your office they need, and they can get it done comfortable. and they're dealing with somebody who has wanted to be a dentist for a long time. Basically, it's not something you were forced into it. It's something you took by choice, and you're still sticking to it.
That's correct. It's like my lifelong dream. You know, when you're a kid, some want to be firemen, policemen, football players, basketball players. I want to be a dental surgeon. So I'm living out my dream.
And you did.
If we all did our lifelong dream, imagine what a world this would be.
It would be wonderful. In fact, it is the most important thing, I think, when we're choosing a profession and when staying in it. Do you like it? You know, if you like it, in fact, love it, all the problems, which will be there anyway, are so much easier to overcome. It's almost like a mother's love. You know, I mean, the reason she can love guys like us forever, despite all the problems we cause, is because she loves us. And if we love our profession, same thing will happen. We will overcome the problems which are there, which will be plenty. But how you overcome them if you don't love it? You know, Dr. William will talk to you lots more about specific procedures. Thank you very much.
Thank you.